Well, hey, everybody. Once again, it is Friday night with Dr. Behave, otherwise known as Dr. Zoe Bartholomew. I'm your hostess for this evening, and this is another Increase Media Moment. And we promise that every conversation we have is designed to increase your input, to increase and influence possibilities of greater, possibilities of better, possibilities of even more knowledge and things that will increase you and everyone around you. And so tonight, it's Friday night. Merry Christmas. I would have on my Santa hat. But I think I'll leave that to the doctor. She is absolutely in character on tonight. We've had an absolutely long, beautiful day with family, friends, and loved ones. And I'm positive you're probably just as full as I am. But I also think it's a wonderful time to prepare you for the approaching year. Look, things are different. Things are changing, and now that the Christmas celebration portions are over, listen, we got to get down to the nitty gritty. There are literally only 6 days left in this year. And not only that, but after this Christmas holiday celebration and this New Year's celebration, your child is going to go right back to school. How about if we get you prepared for such an event? So, listen, today, as promised, we're going to talk about something that's near and dear to my heart. My son, for those of you that know my story and my history, my son is has a medical diagnosis, and so for me, a 504 came in handy. Now I didn't know what a 504 was outside of foster parenting, which I've always had to have access to. But listen, I missed a whole bunch simply because I did not know. And ironically, I got access to the end all to be all at this point. So now I should go lacking nothing. So, with that said, y'all, again, it's Friday night and Dr. Behave is in the building. I know I don't have to introduce her anymore, so I'm going to bring her on in. Hey, Doc.
Hey, how are you?
I'm amazing. Merry Christmas to you.
Merry Christmas.
It's super good to see you. I pray you had a great day. How was your Christmas celebration? Let's start there.
Bless.
That's
Everybody just relax, enjoy one another in the bubble.
nice.
That's
Right, in the bubble. And that really
right.
me
Stay
right about
safe.
here. A very non-traditional Christmas for me and mine. Did y'all do turkey, dressing, yams, hams? What did y'all do? Did y'all do traditional food? Great tradition.
We did non-traditional. We decided to make some tamales this year, so that's what we did.
So
Yeah.
y'all, I know this is off topic, and I promise we're gonna get to this IEP 504 stuff in a minute. But listen, we got to be real people. It's Christmas, right?
All right.
So now you guys make handmade tamales. My grandmother used to make tamales every
Yes,
single year.
yes.
Shut
My
up.
partner and I and our daughter, we made tamales. That's
Shut
our first
Can
time.
your
They
girl
came
get
out
one?
pretty good.
I just need one. I,
Yeah, we
I
got
just
some
need
left
one for
over.
all time's sake.
Got some left over. It's all good.
Good stuff. Good stuff. Well, listen, we are here again and we're doing something that I think has lacked the attention necessary to really create traction, especially in Black and Brown communities. And not that it's not needed in all communities. Information is information, no matter where you are geographically located. Um, but I want to talk about this whole idea, concept, truth about IEPs and 504s. Um,
Okay.
I've shared with you that Josiah has a 504. So,
Hmm.
will you do me a favor? Will you just give us a quick jump start?
Okay.
Tell people what the difference is between an IEP and a 504, if you can do it that way, or should we do it?
Yes,
Okay.
definitely.
Okay.
So, I'll start with the 504 plan. So, a 504 plan is regulated and administered by the Office of Civil Rights. So, there's a difference right there. So, an IEP is usually The federal funding and so on for that is under the umbrella of the U.S. Department of Ed, but specifically the Office of Special Education. So as always, I try to break down so you guys can see things at a federal level, state level, local level, so it can see how it funnels down to you.
Right.
So with an IEP, you have to get an assessment completed to become eligible. But with an IEP, there's only 13 categories of special education disabilities that are under that umbrella. With the 504, this could be all types of disabilities that aren't under the special ed category. So it could be outside of the 13 categories, hence why your son was able to get a 504 plan for medical purposes. And sometimes you can have both, because we may have some students who have a special ed category, but also have a medical condition, so they may need different supports. So sometimes that happens. It's a case-by-case basis. With the 504, you're coming in with some kind of medical report from a medical professional who's saying this is what this student's needs. So whether they need access to the bathroom, whether they need more time, whether they're going to be off, but it has to have some kind of medical information that's basically specifying what kind of medical condition they have and what they need. And it gets a little tricky because of FERPA, which is the Family Privacy Protection Laws, as well as HIPAA. Sometimes we don't want to have to express what medical conditions there are, but in this case, if your child really needs some additional supports, accommodations, and modifications in particular, it's good to disclose this information so they can get access to that. The other thing is, usually there's a 504 coordinator, or usually it's the admin, vice principal, or principal who kind of regulates and monitors the 504 plans, whereas with the IEPs, this is monitored by the special education department. And in order to receive an IEP, you have to actually go through an assessment process to become eligible. And again, it's under those 13 categories.
Wow. Okay.
Yeah.
Okay. So you said so much, though. I mean,
yeah,
you said a lot. With the difference between the IEP and the 504, you said 13 specific categories, right? Those are all classified and have to be part of that treatment program or assessment in order to get access to an IEP, correct?
Yes. Yes. Okay. And with those 13 categories, I just want to point out, there are specific characteristics under each of those categories. So one in particular that often confuses people is the autism category. So last week we talked about autism.
Right.
Well, autism, you can be labeled with autism on the special education side and on the medical side, but sometimes the students don't show up, meaning the characteristics don't show up and are relevant on the school campus, so they don't get assessed and eligible for special ed because they don't show those characteristics at school, meaning they have to hit those characteristics in order to have it. So this is confusing to some individuals who are coming in, their child has autism, they automatically assume they should be found eligible because the doctor found them eligible. That is not always the case. So some of those students may actually qualify for a 504 plan, but it's very confusing to families. So meaning the school has to observe these characteristics. They have to see it and actually be able to document it. And so if they don't, it's hard for them to say you meet that category.
So let me ask you another question, because it can be the difference between a child not only getting the appropriate help, but it could be the difference between them qualifying for special provisions that would really be assisting, for some of the children that are dyslexic or, may struggle, have a standard learning disability. But really having an IEP and or a 504 could really give you access to tutoring programs that wouldn't otherwise be available. Special time for testing and project returning and things that would make the difference between your child passing or failing. Is that an accurate assessment?
Yes. So what happens is either one has what they call accommodations and modifications,
Okay.
right?
Mm-hmm.
And accommodations are additions to what they already have. So students will have access to whatever other students have access to, but they may need some additional like services or supports to help get them to where they need to be. And so that is considered an accommodation.
Mm-hmm.
With the modification, that means they may need a change to their programming. So when you're talking about there's a possibility of they need more time for assignments, maybe they need to turn their assignments in a little bit later.
Mm-hmm.
And that may be meaning it may be different from the timeline of when other students submit their stuff. Another one is like modified grading. They need to be graded differently. Maybe they need a pass or fail versus the regular letter system. It just varies, and there's different types because again, it's all individualized on both sides. Whether it's an IEP or a 504, it's what that student needs, and all the educators on that student's team are required to implement what's written under those accommodations and modifications. So it's very important to make sure you have it documented and to make sure everyone on the team knows what they are and knows how to implement them.
Okay. So if you had a parent or ran across a parent who had not yet perhaps received the proper documentation to even begin to approach the idea of having an IEP put in place, or maybe dealing with some medical ramifications, and they haven't yet approached even the school, especially considering now with the transition in distance learning and our climate and environment in its totality being transitioned. What would you say first steps would be for a parent that feels like their child may need some special provisions in order to progress and to thrive as opposed to struggle and to miss it? Considering they can't observe them in the classroom now, right?
Yes.
Real talk.
So the first step for families, and this is something I tell all my families because it starts a timeline and it holds everyone accountable. You need to write a letter. And when I say write, that means type of a letter, handwrite a letter. You have to send it certified mail, and you're sending it whether it's to the site principal, so the school principal, or it may be sending it to the special education director, or sometimes they have middle managers called program coordinators or program specialists. But the point is, you can find all this information of who you're going to send it to simply on the school district's website or the school site's website, because they usually have their email addresses or their names. And basically, you're sending this letter to say, I'm requesting a formal assessment to be done on my child. And in that letter, you can state why. So you're saying, because I'm noticing they're failing in school, I'm noticing they're having behavioral challenges. If it's a medical piece, you can disclose that there has been some medical history that's impacting them. And so I actually have a letter framework that I give to parents so you can have a guide, because I know this is a lot for people to take in. And I actually want you to keep it short, simple, to the point, one pager. So I created a template that parents can use and just put your information in there, and you're able to send that out. Once you send that letter, legally, they have up to 10 days of receipt to actually respond back to you. So this is why I'm having you do this versus sending an email or just doing a phone call. We need documentation. So we have to have this documentation to keep this timeline going.
Very good. Okay. So that being said, so again, an IEP requires an assessment, right?
Yeah.
So if your child has not already been assessed, the very first step that the family needs to take advantage of is writing a letter to that specific site principal and request a formal assessment and explain to them why. Now, because our children are out of the classroom, it is not so easy to assess if in fact they may need additional help, right?
Well, I'll chime in. There
Okay.
are some exceptions to the rule. So, yes, right now we are in a pandemic. We're trying to do things online, but realistically, we still may need to have that student come in to actually have some assessment done.
Sure.
So there are some sites, and I can't speak for every single district, every single school site, but we are allowing the student to come in to participate in that type of assessment so that is completed. And it depends on which person is assessing them. So there's multiple people that could be assessing them. So originally, the person who's going to assess is, of course, the school psychologist, because they're the ones who look at everything. And then there may be other components, like we talked about occupational therapy a little bit last week.
Mhm.
That person may assess if that's needed, if we're noticing that student is having some writing issues, which is like a fine motor issue.
Mhm.
If they have some speech delays, the speech person may actually assess them too. So again, there's this assessment plan that will be given to the family to see which areas they're going to assess in, and they actually have to sign that before assessment anyway. So they're going to see exactly what their child will be assessed in, which categories and areas.
Okay. Okay. So that being said, now is that a part of your book, which can be actually you can scan this electronic barcode like literally as I speak to gain access to Dr. Behave's book, and that may also assist with the process. But outside of that, you can also go to drzoebartholomew.com, send her an email, and we'll make sure that if you need that worksheet, you actually have access to that worksheet. So there are two separate options for you. You can, again, you can email Dr. Behave at drzoebartholomew.com, or you can actually simply scan this barcode. Let me move our banner so you can you can actually scan this code and get access to the book Behave. I think that both will be not only beneficial, but will be strengthening to any parent who has a child that is in need of additional support and assistance in thriving. That's our ultimate goal. And just
Yeah.
before we go in a little bit further into the discussion, I want to also encourage, as we are building this community, we're building this parent advocacy peer group in order to support effectively people that have children with special needs that are struggling, trying to get the help and support we need, especially in this climate. You can always become part of that community simply by going to the Facebook group, and you'll be able to see it in the comments as well. And always keep in mind that if in fact you have maybe had an IEP in times past and you know you've not effectively used the system or the service to benefit your child, listen, the wonderful thing I appreciate about Dr. Bartholomew is that she's super hands-on. So you're more than welcome to contact her at the Calendly link that's provided here. Dr. Behave at IEP support. And it's not calendar, it's Calendly. So I'll put it in simple format. And all you have to do is click on the tab that says IEP support. It's almost like a defendant going into a criminal court proceeding with a well-armed attorney, right? So it's like having someone on your arm that sparkles and dazzles as y'all walk in the room because they know who Dr. Zoe Bartholomew is, I assure you. So as we begin to kind of come to a close, because we don't want to hold you, it is Christmas now, but we do want you to have this information and be able to come back to it, and we wanted to stay consistent with our days and our showing up, and that's just the level of commitment that Dr. Bartholomew has for her craft, for her children, for the passion that she serves in the community with, that we don't want to break up the time, because for real, and a new year is approaching, guys, and we got to do things a new way.
Yeah.
So if there were maybe three major things that you would tell to a parent that maybe has not identified, is still trying to identify, or really just kind of needs a tip or a trick, what would those three things be, Dr. Bartholomew?
The first thing I want you guys to do is to accept that you've identified that your child may have something more going on with them. And I'm just going to leave it as that, because until your child is properly assessed and evaluated and some data collected on them and so on, you may not know what that is. So, acceptance is important, because sometimes we do a level of denial, and that will prolong the process. And I need you guys to be willing to accept it. I think I said it in the first show. Remember, it's not about you, it's about what they need, it's about them. So I want you to remember that. The second thing is to take action. So we accepted it. I'm giving you steps today. You have access to someone like me. So you need to take action. So you need to work on that letter, write it down. It doesn't matter. I've even told parents, if you're not comfortable with writing, record yourself and then copy it down. Ask for help from family members if you're afraid. And then again, I've created a framework to help you kind of frame it correctly. So I don't want you to get caught up on that. And then lastly is to be patient and wait. So what's going to happen is, this is a process. So your child isn't going to be magically assessed as soon as you send that letter out. They will have up to 60 days to finish a full evaluation. So you're going to need to be patient at this time. You're going to be waiting, basically. And it's okay, because at this point, you've done your part. So now it's a waiting game. And then once you have waited, you'll start to see the results. But you definitely have to be patient, and you don't want to get aggressive and trying to call the school and become confrontational. You don't want to have that look on your hands. You want to be patient, because everything is a process. So once they get you through process one of saying, hey, we will assess, then there's a process for the assessment, then there's a process to actually review the results, and then there's a process to develop this plan, whether it's an IEP or a 504 plan. We're going to develop this plan, and then it'll be go time. So that's a lot. So that's, at least, I tell parents, this could be anywhere between a 3 to 6 month process. And so you need to be patient, and you can still get different supports available to you. You can contact me as a resource. I can show you where you can go. And then again, the district usually has different resources and supports too. So you're not going to be left empty handed, but you definitely have to be patient.
Very good. Very good. So just a really quick overview as we get ready to get out of here. The very, very first step for families is to write a letter to the site principal with accurate information, requesting a formal assessment and giving them the why you are even asking for such a thing. You also want to make sure that the three major things that Dr. Zoe shared today was acceptance. Own it, handle it for your child. It's sometimes a difficult thing. I know when I got my son's diagnosis, that was hard. It was very hard to accept. But once I was able to accept it, I was able to position us to take action and to do the necessary things to make sure that his 504 was in place for his academics, and make sure that the necessary treatments and programs were enrolled in to ensure that he stays as healthy as possible. And thirdly, be patient. Honey, don't you go up there harassing the people about your baby, and he might have ADHD and he's a handful all by himself, and he is not in now special education class, and the teacher and the kids, everybody going bonkers, and now you frustrated. So just to be sweet, nice, and kind, be patient and respect the process. That being said, guys, listen, we have talked about it today. A quick conversation full of information. Please, ma'am, please, sir, do not forget that you absolutely have access to Dr. Behave. More importantly, to ZMB Consulting and yours truly, Ladybug herself, drzoebartholomew.com, right? If you need access to the form that she mentioned, please don't hesitate to visit the website, shoot her an email, and ask for the form. I'm sure she would be beyond happy to send it for you. Again, listen, that's our time. This has been another Increase Media Moment. And today we talked about IEPs and 504s with our resident guest, Dr. Zoe Bartholomew. Any last words before we go, Dr. Zoe?
Just try to take it easy. It is the holiday, so right now I could just let you know now schools are closed until they return. So don't try to, send something now. You can prepare a draft. It'll get to them. That'll be fine. But just be patient. Again, this is a process. Enjoy your time with one another, and just try to get a breather before school returns.
Very good. Very good. Super important. Well, again, listen, happy holidays to you guys and happy new year to you in advance. We hope you have an amazing, amazing day. Thank you so much for joining us today. We look forward to seeing you next week. Same bad station, same bad time, right here in the Increase Media Moments. Have a wonderful evening, guys.